Hi, I'm Dr. Pete Campbellis, and I'm a medical director at Buckeye Health Plan. I can't count how many times I've heard patients say, I couldn't get off work, I didn't have a ride, or I didn't know where to start. These are real stories and real reasons that patients delay care. And as clinicians, we see what happens when those delays lead to more serious issues later on down the line. And today we're talking about what's behind those barriers and how we can help make access easier for every patient every time. And I'm pleased to be joined by my colleague, Dr. Michelle Blanda, who's here to help us unpack the most common challenges and share ways to close those gaps. Thanks for being here, Michelle, with me.
Thanks for having me. This is one of the most important topics we can talk about because access impacts everything. If a patient can't get to us, they can't benefit from the care we provide.
Let's start by naming it. What are the top barriers that you see most often?
Well, there are a few barriers that come to mind. First, the one is cost. Even patients with insurance may delay care because they're worried about copays, deductibles, or past medical bills. I've seen many patients who've skipped blood work or testing for months just because they were afraid of the cost. But remember, for Medicaid members, covered services are provided at no cost to them. And as a clinician, help educate your patients about this as you encourage them to seek care. The other thing people worry about is where's the office located and how am I going to get there? This is especially true in rural areas where patients may need to drive an hour or more for a routine visit. If they don't have a car or reliable transit, they simply can't make it. And then remember about health literacy and cultural barriers. A lot of patients struggle to understand their diagnosis or how to manage a condition. If the language is too complex or unclear, they're more likely to give up or stop treatment. And make sure to provide information to the patient in their preferred language. Buckeye and other health plans offer interpretation services to help our members better understand their care.
Boy, that list really hits home. I've seen each of these show up in my own practice, and so the question is, what can we actually do day to day to start removing those barriers?
Well, I think there's a lot of things we can do, and we really need to use the tools that we already have. Remember, you can offer telehealth, and you can be flexible in your hours so patients can find an option that works for their schedule. Connect patients to the transportation services that are part of their benefit, like Buckeye's Ride benefit or local community partners. It's important to screen for social needs and take time to ask, what is getting in the way for you right now of getting your care? And then last, train your team to use clear, plain language and confirm understanding with TeachBack.
These are all great strategies, and I'd add that even with small steps, like following up after a missed appointment and explaining an after-visit summary rather than just handing it to a patient, these things can really help patients stay connected to their care. And let's remember that every small effort to close a gap really does matter. And when we build trust and remove these friction points, we see better engagement and better health outcomes. Dr. Blanda, thank you once again for this helpful conversation on this very important topic. And to all of those watching, thank you for the care and compassion that you bring to this work every day. Together, we can help more patients get the care they need when they need it to help them get healthy and to stay healthy.